We are on live, sir.
Yeah. We are starting the session today, ma'am.
Yeah.
So very good evening, doctors. I'm Dr. Stalin on behalf of Shield Healthcare, welcoming you all for the today's webinar. We have an interesting topic today, that is stress and infertility. I welcome all the delegates and I request them to post their queries, if any, in the chat box so that we can have a short QA session at the end of this presentation. Now it's time to introduce our invited speaker for the day, Dr. Meenakshi ma'am. Madam has done her MBBS DGO. Madam is the senior obstetrician and gynecologist at Dr. Meenakshi Maternity and Clinic, Child Clinic, New Delhi. Madam has a very wide experience of 22 years plus experience in this field. And with this short introduction, I welcome you, ma'am. I'm handing the session to you for your presentation, ma'am. Welcome, ma'am.
Okay, thank you, Dr. Stalin. It's my pleasure to welcome you all in this nice afternoon. It's raining outside and the Mawsam is very good. It's cool outside. So let us study something about stress and infertility. We always say to the patient that just relax and you will be all right. Like this is the first advice we give, that just relax, you will be all right. But this doesn't work in infertility. Why? The slides are not moving, madam.
Ma'am, to the left bottom, there will be like arrows, ma'am. So you can click on that.
Okay, left bottom. Yeah, now it's moving.
Yes.
So, why we want to study this topic? Because infertility is on the rise and India faces a high burden of infertility. Around 22 to 33 million couples in the reproductive age suffering from lifetime infertility issue. And every 1 in 4 couple is struggling with infertility, and more young Indians are finding it hard to conceive. And at least 15% of married couples are experiencing fertility issues. 40 to 50% are attributed to the females. So study, previously we used to study 30, 30, 30. No, now it's 40 females, 40 males, 10 is combined and 10 is unexplained. And surprisingly, we all know that male infertility is on the rise with every passing year. So there are many factors which have impacted the infertility rate in India. Some most common, we also know that unhealthy eating habits, unhealthy lifestyle, smoking, alcohol, medical reasons are like medical problems are on the rise, like hypertension and diabetes. And also they are using too much of contraception that they are not conceiving, and so they are also getting married at a later age. Then accordingly, we can see that PCOS and stress, they also contribute to the infertility. So whenever a couple is diagnosed with infertility, there are several emotions that they undergo, like shock, surprise, denial, anger, frustration. Why is this happening to me? Anxiety, fear, panic, lack of knowledge. So isolation. They feel isolated from their family and out of touch with their partners, and sense of loss of motherhood or fatherhood. And this can continue through all stages of infertility. So can stress be a cause for infertility? So this is a debatable topic. Previously, we knew that stress alone causes infertility. It's a debatable topic because couples undergoing infertility, they have more levels of anxiety and depression. So it is important to recognize that these couples, they have to be assisted psychologically also. So there is a direct link between stress and reproductive dysfunction, and this has been well established. Many studies are coming up, and from last 20 years, we have so many studies coming up. Psychological stress experienced by female and male partner has been associated with lower conception rates, and animal models also suggest that. And stress can compromise every aspect of infertility, like libido, sperm quality, ovulation, and implantation. It interferes with the hypothalamic gonadotropin releasing pulse generator, then LSH and FSH release from anterior pituitary, and then acting on the ovary and acting on the endometrium also. So it can also affect the pregnancy outcome also post-conception because of the unsuccessful blastocyst implantation. So what happens in our body whenever a stress is encountered? So what is stress? Stress is like anything which we see to us that it is threatening to me. So what will I do? I will fight or I will flight. Means our body will say कि you have to fight with this. And when we like हम जब थक जाते हैं तो हम सो जाते हैं या फिर हम लोग छोड़ देते हैं इसको, and then we go into chronic stress, and there set the chronic stress and which is more detrimental to the fertility. So we have two systems in our body which regulate our whole reproductive system. We have two systems: hypothalamic pituitary adrenal axis, then hypothalamic pituitary gonadal axis. So what are the relation between the two axes? Just in few slides we will discuss this. So whenever a stress is there, hypothalamus has two types of neurons which secrete like argin vasopressin and corticotropin releasing hormones, and they receive inputs from all the several brain regions like amygdala, brainstem, prefrontal cortex. So what will happen? Corticotropin releasing hormone is released into the median eminence. Then it will act on pituitary, anterior pituitary. Then there will be release of ACTH into the circulation. Now what ACTH will do? It will stimulate the glucocorticoid release to regulate glucose and fat utilization, storage, memory, immune functions, and other stress coping strategies, as well as negatively feedback on glucocorticoid and mineralocorticoid receptors in the hypothalamus and hippocampus to suppress further HPA activation. Then the other axis, that is hypothalamo-pituitary gonadal axis. So what again? This GnRH pulse release into the median eminence, then it will act on anterior pituitary to release LH and FSH. Then they will act on ovarian system so that ovarian steroids, that is estrogen, progesterones, are released, and they will carry out both negative and positive feedback according to the stage of the ovarian cycle. And in males, there will be GnRH leading to gonadotropin secretion, and there will be negative feedback. Now, pituitary gonadotropins also stimulate steroidogenesis. So what will happen? Now, what is the basic intersection? How is these two axes are united? So CRH, this can directly inhibit gonadotropin releasing hormone pulse generator. So there will be suppression of anterior pituitary gonadotropins, that is LH and FSH won't be released. So there is no release, then there will be no oocyte maturation and no steroidogenesis. And there will be also glucocorticoid will act on the level of pituitary to suppress gonadotropin release. So there will be more suppressive effect. Plus, there will be sympathetic activity that will go on increase, and there will be more production of noradrenaline. So they will lead to sympathetic innervation of the ovary increase and contributing to the development of ovarian cysts. So now we come to the studies. Right from this therapeutic advances in reproductive health, it is in 2022 that this is the latest study that anxiety and depressive symptoms are most common among women with unexplained infertility, and strategies should be developed to better support and treat this high-risk population. Other studies say depression and emotional stress is highly prevalent in women among recurrent pregnancy loss. Another study says that it has a significant impact on infertile women's mental health. So there has to be a psychological approach, and that should be a part and parcel of infertility treatment. Then 22% of infertile women in clinic in Middle East Fertility Society Journal says that stress is mainly associated with the duration of their infertility. So what happens in women? There is a study and which showed that anovulation or amenorrhea in females, the most common reason is stress-induced anovulation. You know, every patient coming to amenorrhea will come to you and say, "मुझे stress हुआ था, शायद इसलिए हुआ. I think I am undergoing stress, so there is no periods." And this is the most common. We already knew this. We already know this. So what to do? So we have to rule out other causes of amenorrhea: hyperandrogenism, PCOS, hyperleptinemia, ovarian failure, premature Asherman's, and other can be there, minor ones. So how does stress affects ovulation? We have already said that under chronic stress, HPA axis is activated, leading to release of cortisol and corticotropin releasing hormones, and they will act on pituitary. So no LH, FSH release and no ovarian ovulation. How does stress affects ovulation? Ovulation obviously अभी तो हमने बताया कि LH और FSH जब नहीं होगा तब क्या होगा? There will be some disturbance in the negative and positive feedbacks. There will be increase in the adrenal hormones, and there will be they will negatively go to the pituitary and lead to release of cortisol. Plus, progesterone can also stimulate LH secretion. So all they may lead to premature LH surge. So LH, if not inhibited, it will come early. So it will interfere with proper follicular maturation and ovulation. And furthermore, LH concentration at different stages of cycle may have conflicting effects on maturing follicle. And plus, साथ में there will be endometrial lagging behind, so that doesn't lead to implantation. So increased cortisol levels as well as oxidative stress that affects the granular cell function, and there will be more of apoptosis leading to poor reproductive outcome. Then on this embryo implantation, that is endometrial activity, because there is disturbance in the steroidogenesis, so that will lead to what it will lead to? It will lead to inhibition of epithelial and stromal cell proliferation, inhibition of stromal cell differentiation, altered endometrial gene expression, impaired endometrial receptivity, and ultimately no implantation. So in males stress is equally responsible for infertility, because ASRM society says that it is semen quality is more disturbed with stress. So men who feel stress are more likely to have lower concentration of sperms and more likely to have misshapen, or that is abnormal sperm heads and abnormal motility, because glucocorticoids are released and they will blunt the levels of testosterone and sperm production is defective. Another possibility is oxidative stress. We all know that oxidative stress is a very common factor for male infertility. Then this study favors the previous statement that I said. Then emotional stress on sperm quality, apoptosis and necrosis is very much high. Meiotic and structural alteration also happen. And marginated chromatin, swollen, badly assembled mitochondria, they are the typical ultrastructural markers of apoptosis. Then relationship between psychological stress and reproductive outcomes in IVF also. So in IVF also there is a study that concluded that both pregnancy rate and live birth rate in IVF patients with stress, anxiety, it is partly mediated by activities in the hypothalamic axis and sympathetic nervous system, and this will lower the IVF success rate. More the anxiety, less the IVF success rate. And most common anxiety and depression, that is major depression, is the most common symptom in the infertile couple. ICSI, during ICSI, if you do the stress management, there is better result. This is the study which was conducted in 2020, that if you do a psychotherapy, that it will lead to improved outcome. So what will happen? If there is stress, patient withdraw, isolate from family, friends and community. Actually, they will have something to explain that I am not getting pregnant, but as a month goes by, there is more feeling of stress, anxiety and depression. So stress happens because in IVF or ART procedures, any treatment procedure, patient have to take time off from work, got her blood test, pelvic examination, ultrasound, injection, daily injections, timing of intercourse, timing of endometrial ovulation pickup or endometrial transfer, various diagnostic procedures, hysteroscopy, laparoscopy, and most important, in our country, cost factor is the greatest inhibitor. And because of the cost, many people will go into anxiety and depression because they can't afford the costly treatment. So, effect of reduction of stress before fertility commences, there is evidence that personality dimensions, coping modes, stress, susceptible, resilience correlate with IVF outcome, and stress increases the dropout rates. Not because that patient cannot afford, But because of the stress, they will drop out right from the second cycle. So behavioral treatment has to be there, aimed at reducing stress in IVF and ART also. The short-term goals kya hai? But how can we help them? That we can help by cognitive behavior therapy, so that they are feeling less helpless. There is change in sexual behavior. Then negative feelings have to be overcome. Then you have to impart knowledge about fertility and improving the marital communication skills. Chronic stress is a very bad factor, and if the patient or couple, they cannot cope up with the chronic stress, then the anxiety and depression sets in, and that is the chronic stress is the most important thing that we have to see through it. So how do we know that patient or the couple is stressed? How do we know? Just by talking to the couples, we can know that they are undergoing stress, and also we know that this couple has already taken from so many doctors, and they are coming to you after a gap of 5-6 years of marriage, or 10 years, 15 years. Still they are not getting pregnant. Those stress levels, they are so high that if you start any treatment, that it will fail. So what do we do? You have to establish the stress level before you start the fertility treatment. You have to see that this patient is having high stress level. Although there are many biological tests we can offer, but they are not cost, in our country, they are not cost effective. Cortisol measurements and serum alpha amylase measurement in the buccal mucosa. So they can be tested, and if their high levels are there, then we can stop the fertility treatment, go for psychological or stress treatment prior to infertility treatment. That is recommended. So, but it can go side by side also. By the time the stress levels are reduced, then you will see that patient has already investigated. Then you can start with the treatment of the infertility. So psychological interventions, there are the single most factor that can affect stress levels. So psychological, you may have other procedures like cognitive behavior therapy, relaxation. Then technically, you can take frozen semen samples before at low stress moments outside the fertilization cycle. Then neurobiological means like acupuncture can also be done, or other tests can also be done so as to rule out that patient is not going under major depression. So infertility, you have to assert 3 things: that infertility involves the stress in the couple. Then stress may be primary or the secondary cause of infertility. Then stress management. So no one expects patient to approach fertility treatment stress-free. Finding ways to minimize stress while pursuing treatment can help. So what are the ways to reduce stress? That you can ask, that talk to your partner. Remember, you are not alone. You can talk to the people with infertility. Read books on infertility. Do meditation, yoga, progressive muscle relaxation, or acupuncture. Don't take much of caffeine. Then do exercise regularly and do meditation. So because I am very much fan of yoga, so I do advise yoga to every couple, to every PCO female, so that her ovarian cycles are much better utilized. So these are the few poses. The one on the left side that male is doing, this is cat and cow pose. Then there is bridge pose. Then there is the couple pose. Then there is Ustrasan. Then there is Konasana. That is late ke butterfly karna. Butterfly is a very good asana. I like it very much. So these are the few poses. So in every management of infertility, in every patient, you should ask for don't say that you do exercise. What exercise? So you can ask her to regularly exercise, yoga and meditation, because what is yoga? This is body and mind, balance and health. So mind, body, balance, health. These are interrelated, and yoga will help. Definitely yoga will help. Then we come to the other part, the dietary supplementation. That may also suppress stress levels, and safe and effective supplement that can reduce the level of serum hormones, that is cortisol and adrenaline, can boost the fertility. So there is one product coming up This is ORAA Spa from Shield. It contains Lactium 150 milligram and L-theanine 100 milligram. They say that it relieves stress and anxiety, normalizes cortisol levels, improves reproductive function, and improves fertility outcomes. So what is Lactium? So Lactium is like, what is Lactium? Lactium is milk protein hydrolyzed. So milk protein होता है, उसमें casein होता है. अब casein के ऊपर जब trypsin act करेगा तो क्या बनेगा? L-casozepine बनेगा. And this casozepine is called Lactium, and it was developed in France first of all, and it works effectively and naturally in stress and anxiety and causes no side effects, neither addiction nor sedation. So वो यहाँ तक पहुंचे कैसे? How did they reach there? कि ये Lactium को कैसे उन्होंने सोचा कि ये stress level कम करेगा? जब आप देखते हो कि whenever a baby feeds her mother, suckles the breast, and within no time baby falls asleep. So what happens to the milk when it goes into the stomach of the baby? It is hydrolyzed, and the product that is casozepine, that has a soothing effect on baby's mind, and she goes sleep. So it is not a sleep, it is not a treatment of insomnia, but it is a treatment of mild to moderate anxiety also. So it leads to 25% reduction in stress-induced cortisol levels within 30 minutes, within 3 hours. Then what does it? Where does it act? It acts directly on pituitary and on hypothalamus. So there is reduced level of cortisol. It regulates the GnRH pulsatile release. So regulates the LH and FSH ratio. In females, there is better oocyte quality and normalized progesterone. So dose is 150 milligram per day. So where does it act? It acts to the omega-2 gamma receptors, improves GABA activity, GABA receptors. No binding to omega-1 GABA receptors, so no sedation. L-theanine is a natural constituent in tea and is effective for its activity, that it decreases the alpha frequency band. So it relaxes the mind without inducing drowsiness. So how do it benefits in stress? That regulates hormonal pathway, regulates neuronal pathway, improves alpha waves. So there is good quality sleep. Then all the functions of ovary and testes are normalized. So there is improved fertility outcome. So ORAA Spa is a product, and I have started with this product around 15 days back. Just 15 days back, when I got this molecule, first I read this and I found that there are many studies with this compound and they are very effective. So why don't we start with this, and side by side we can start with the psychological or behavioral modification therapies along with yoga and exercise to help your patients or clients or couples to get a better functional mind-body balance. So this drug ORAA Spa can be used. So we know that what are the take-home messages point, that we know that infertility can cause stress, leading to anxiety and depression. Stress can make conception more difficult. And stress reduction techniques, when employed on a regular basis, can improve conception rates. Stress reduction is a non-invasive, less expensive, and ethically acceptable way of improving fertility. And fertility treatment protocols should include stress management and stress reduction as factors of major importance. And the professional in reproductive medicine should always test for chronic stress before initiating fertility treatment and adjust selection and treatment protocol accordingly. Thank you so much for patient hearing. Thank you so much.
Thank you, ma'am. Thank you very much for that wonderful presentation once again, ma'am. That was an interesting presentation, ma'am. And yes, ma'am, as we have discussed, the lifestyle and the today's work nature has made the couples much stressed, ma'am. So it is necessary to address these query, particularly when it comes to infertility, because many of the people don't reach the IVF specialist directly, ma'am. They undergo various treatments, they meet various doctors, and then they come to the IVF clinic, ma'am. And at that time, do you think that it is necessary to evaluate the stress level before treating, before starting the IVF treatment, ma'am?
Yes, because we can by just counseling and by just interacting with the couple, we can know that how much stress level is there. Otherwise, if you are confused or whether don't know whether there is chronic stress playing, then you can refer to a psychologist, and then again start the treatment after 2 or 3 months. A gap of 2 or 3 months can be given to start the treatment. Already the couple is stressed because of the long interval between marriage and fertility. So already they are stressed too because of the time frame. But if you can delay for 2-3 months for stress reduction, that is, I think, much will be benefited. I will ask Dr. Renu Manchanda, what is your take on this, madam?
Dr. Meenakshi, I just want to share a few points.
Yes,
like this becomes a self-perpetuating problem. Infertility causing stress, and then stress causing infertility.
Yeah.
So the emotional state is like a roller. Whenever the patients come to us with infertility, their emotional status is like a roller coaster. They're always waiting, like, okay, the UPT will become positive in this cycle. First, they become hopeful after the treatment, and when they get the period and the UPT is negative, then they suddenly go into the lower phase and they have anxiety and depression. And depression is mostly in the latent phase, and sometimes mild depression is also seen. As you have already discussed, that this stress will have caused increased cortisol levels, which have a very harmful effect on the granulosa cells of the ovary, and there is reduction in the estrogen production. So anovulation, irregular cycles, all this again contributes to the infertility. So what what I have clinically seen, that if you advise these patients to take little bit of break, go for a vacation, or having a good communication between both the partners, and as you have suggested that they can have self group help, we can form groups, and they can talk to other patients who are going infertility treatment in the form of IVF. This helps. And definitely psychological therapy, as you have said, assessment of their stress level before starting IVF, and then if they need the psychological support, that will go a very long way for this patient. I have personally not used this product, ORAA, but we can definitely try for 2-3 months and see the result. And like the test you have saying that we can measure the alpha amylase level in the buccal mucosa and cortisol levels, that can, I think, be done after a period of time, and that will give us more objective finding whether the drug is really effective or not.
Thank you, ma'am. Thank you so much. I think the purpose of the meeting or this webinar is that first we recognize that there is stress, or the stress is chronic or acute stress. Then what are the behavior therapies you can recommend to your client, and biological tests can be offered if the patient thinks so that you have to be on the safer side. So it's
and Dr. Meenakshi, I think there is no doubt in our minds that stress is definitely a factor which is contributing to infertility, and infertility itself leads to stress and anxiety and depression. So that cycle definitely needs to be addressed for these patients who come to us for infertility treatment.
Yes, ma'am. I think and their product, as I have gone through the research, so this is definitely a new product, and we haven't used such product for last so many years. So I think it will be a milestone in the treatment of infertility.
But because basically it is Lactium, I don't think there will be any side effect, and it will definitely help. We can give it for a few months and see the result.
Yeah, it's a dosing is 150 milligram once a day for 3 months. Then you can.
Yes. Definitely a trial can be given, because it is not harmful at all, and I don't think it will have any side effects.
Yes. Dr. Meenakshi Shamshuka is there? Hello, Dr. Meenakshi. Okay. Thank you so much, ma'am. I think we can wind up the session.
Hello.
Okay, thank you so much.
Thank you, ma'am. Thank you. Are there any questions?
Ma'am, no, ma'am. Dr. Meenakshi, ma'am, has joined. Ma'am, she is about to say something, ma'am.
Yeah.
Very nice talk. I joined a bit later. Busy ना, got busy.
Okay.
Hello.
Okay. Never mind.
हाँ, कैसे हैं? बढ़िया. Very nice.
Thank you,
Thank
ma'am.
you.
Thank you so much.
Thank you.
Yeah, ma'am.
Thank you, Dr. Meenakshi, for a very nice talk.
Thank you.
Really enjoyed, and a very good topic to discuss.
Yeah.
I think this is a least discussed topic in our webinar.
Yes.
And in any meeting, there's a least discussed topic.
Yeah, but an important aspect of patients of infertility.
Yeah,
And
yeah, I think
this-
yes. After reading so much now, I myself thinking about, like, you can start one lecture should be there for this topic in our next this get together.
Yes, we can have it.
Yes, we can have. Thank you, ma'am.
Thank you, ma'am.
so much.
Thank you for the wonderful time and the time which you have spent with us today, ma'am. It was a wonderful session again, ma'am. So, ma'am, if you allow us, then we can end the webinar for today, ma'am. Thank you, ma'am. Thank you, audience, for your active participation, and I also would like to thank my team for arranging such a wonderful speaker for today's topic, stress and infertility. And ma'am, thank you, ma'am, and we are looking for many more webinars with you in future too, ma'am. Thank you, ma'am. Ma'am, you are on mute, ma'am, please.
Do share the recording. I will share it.
Sure, sure. We'll share the recording.